Right, public health in Britain, very straightforward. Public health is what the government does to look after the people that it's responsible for. Now, your course is split into 4 parts. Medicine standstill, beginning of change, scientific revolution, and then modern medicine. So I'm going to try and split this into 4 parts to cover that. Your course also starts in 1000 AD, but contextually I think it's really important you understand what used to happen in England, or Britain, and how that changed over time. So I'm going to start in the control of the ancient Romans and Britain. I'm going to move through what's called the Dark Ages, possibly we shouldn't call it that, for various reasons I'll try and explain, and then I'll go through into what it looks like today, which I'm all pretty sure we're very, very aware of. So, like I say, public health before 1000, not technically on your course, but contextually it's really important to get you to know it, so let's run through some of that with you. If we look at Roman Britain, the Romans were here about 500 BC to about 250 AD. Dates not as important for you in this little bit. But what did the Romans know? Well, the Romans knew prevention was better than cure. They knew it was cheaper, cost effective and productive. So they were very, very good at building things and putting in measures. What you've got is this really strong system of centralised government. So all the orders are coming down from the emperor. They're all being passed out through the channels, through the communication channels that are put in place, and therefore everybody follows it. So if they're taking over a new area, what they introduce is this thing called the Roman Peace Patrimana. We're going to take over you. You're going to be our citizens. You're going to belong to us. But actually, that will make all of your lives better. The more control we put in place, the better your life's going to be. All of the things we put in place originally for the army, because the army kept the peace, and then they were cascaded out to other areas. So what did they do? They cleaned swamps. They built hospitals. They built bathhouses. They had sewers. They had water fountains. They had doctors. And all of this was available, first of all, for the wealthy, but also cheaply in big, big cities to other people. Very cost effective, very good. There's a video on the bottom of that. Follow the link, have a look through when you get a chance. Then we get this period that some people call the Dark Ages. Now, it's really unfair because it wasn't. People were still as clever. People were still doing stuff. They were just doing it in a different way. They've had years of Roman occupation. After the Romans go, they change it up. They live their life differently. They go back into smaller groups. England gets split into these kingdoms. And because there's no real central government, the public health things are left and are not kept up, so they don't get them. What we get at the end of this period, of course, is the arrival of Christianity. Christianity brings back in a form of centralised government, not through the king or queen, but through the belief in God and the church. And as we know, that's going to develop into things like monasteries, and organisations like hospitals, which are going to be set up to the church. So contextually, that's the background. Right. Part 1. Medicine stands still. Clues in the title. Not huge amounts is going to happen, but we're going to look at what public health was available around about 1000 AD to around about 1450 AD. So what do we get? We get growing professionalism amongst doctors. We know that universities are set up at Padua, Louvain. They're training doctors in Oxford and Cambridge. Really, really important. They're still working on Hippocrates and Galen's ideas. They are still all over medicine. So urine analysis, we've talked a lot about that. The 4 humours, really important. This idea of balance. And towns are run by the rich. So you had these things called town corporations, where the top sort of 10%, the richest people in the town, could make decisions independently from the monarch, independently from the church on public health. But they were of the belief, really, they shouldn't pay for everyone. They were probably giving money to the church and felt the church should do it. So only really at times of massive epidemic did they do anything about it. So a medieval town would be dirty. There would be rubbish on the streets. There would be sewage on the streets. There'd be bits of animals where they butchered their own animals on the street. There'd be cats, dogs, rats feeding on that. They'd share a toilet system, probably a cesspit, which is a big ditch, or they'd dump things in the local river. So you did get epidemics. However, places like York with big monasteries were healthier. Canterbury, the cathedral there, had 5 settling tanks for water. The monks brewed beer. They gave out, which they drank because it was not strongly alcoholic. Monks washed between meals. So there were signs that public health could be done correctly. Hospitals were run by the church, but remember again, hospitals were based on on care, not on treatment. They weren't giving you drugs and stuff like that. They were making sure you were comfortable and preparing you for God, essentially. Again, follow the link on the bottom at some point, watch the video. The biggest epidemic, and of course we would have covered this clearly, is the Black Death. The Black Death sweeps through the world, probably coming on the Silk Road through China. There are some very clear modern parallels here. Wiped out something around a third or half of the population of the world because there was virtually no way of stopping it. Now, there is modern kind of theory that it wasn't actually the plague, that it was some other disease, anthrax, SARS, Ebola. We just don't really know. What we do know at the time is there was no clear-cut cause, treatment, cure. So people tried everything. Religion was still omnipresent in everybody's lives. So there was a lot of talk of God is punishing us. We had the flagellants moving from town to town, beating themselves. In Germany, but also in England, there were attacks on the Jewish population who were non-Christian, blaming them for poisoning wells, etc. There was some clear practical advice: avoid victims, quarantine, self-isolate, whichever you want to call that. That happened, but a real combination. But here's a public health measure: the Lord Mayor of London orders the streets to be cleaned to get rid of bad smells, but no real consensus. So again, no massive public health measure. Again, watch the video at the bottom.